Hey, hello everyone. Thank you for joining us. We are live from Houston, Texas. I am Dr. Deigni. I'm a board certified plastic surgeon. For those of you who are following us already, welcome back. For all of you who are new, please go ahead and like Deigni Plastic Surgery. Follow us also on Instagram and YouTube. Same handle, Deigni Plastic Surgery. We are going to be spending an hour answering questions about body contouring procedures. So that includes the mommy makeover, body lifts, breast surgery, so breast augmentation with implants or fat transfer, liposuction, BBLs, also the drainless tummy tuck, which is my signature procedure, and all of the above. So we do a host of procedures in the office as well, under local anesthesia with patients awake. And we also do the majority of our procedures in a same-day surgical facility where my patients get to go home once they're done with surgery. Hey, LaWanda Wilson, how you doing? Nice to see you. We missed you last time. Hope all is well. And I can't believe it's already almost the end of April. Summertime is here before we know it. Okay, wonderful. We got Joseph Brave from Montreal. I would love to do a tummy tuck. Absolutely. We'll be happy to have you come in for your tummy tuck. We do have some patients that fly in from Canada, from different areas. The easiest thing for you to do is put your information in the bottom left of the screen there. There should be a form. Click on it, put your name, phone number, email, and just say, you're interested in tummy tuck. My patient coordinator, Linda, will reach out to you and will guide you through the process. We look forward to meeting you and take care of you. For you, we will start with a virtual consultation since you are out of the country. And so I do that for all of my patients who are wanting to have consultations and get ready for surgery, who are not in the Houston area or able to fly in or drive in for an in-person first consultation. We'll get to see you before we operate, of course, twice before we operate. But the first initial contact will be through a virtual consultation. Again, this is our phone number, 281-724-3138. And we are open 9 a.m. to 5 p.m. Houston time, so Central Standard Time, Monday through Friday. Matt question marks. How much is a tummy tuck? The drainless technique that I do for my patients is $13,000 on average. And it includes your anesthesia fees, facility fees, the surgeon's fee, all of your post-op appointments with me, as well as your garments, your pre-op and post-op kits. And also includes the scar treatment that I have all my patients do. And I compound it at the pharmacy and they get it, we get it there. Okay, Joseph. Yes, there you go, Joseph Perez. I just answered that question. And also for any other questions about pricing, please go ahead and contact us. You can call our office or just put your information in the bottom left of the screen there, and we will reach out to you, give you some estimates. Once you come in for your consultation, or if you get your consultation virtually, we will be able to develop a specific treatment plan for you and what your procedure is going to be. And so at the end of that consultation, we will actually generate a quote that is specific to you. So you'll know exactly how much it would cost. Terry, my special day is coming up next week. Whoa, wonderful. Looking forward to it. That's true. I believe Thursday and we operate Friday. But next week, looking forward to it. All right. Thank you for following us and participating in on this live Q&A. User log number. When does the swelling really start to go down after the tummy tuck? So when I do my technique, it's a drainless technique. My patients will have a small amount of swelling, usually for the first 2 weeks. After that, there's very minimal swelling at all. By the time they come back to see me at their 3-week appointment, there's a very, very minimal amount of swelling. But again, that's the drainage technique that I use, which is different than the traditional technique where you have drains in. Usually for that technique, patients will be having drains for about 2 to 3 weeks, depending on how much fluid your body is producing. Then they remove the drains and you still probably have another couple of weeks of swelling after that. But for my technique, it makes your recovery a lot easier, accelerates your healing process, and allows you to actually start walking upright within 3 days after the surgery. So it's a game changer and it's wonderful. All things K. Do you do the mommy makeover? What's included? Yes, I do. So for example, here on the before and after pictures, you can see that my patient is 3 months out from her mommy makeover. The mommy makeover will be tailored to you. Thank you guys for liking the live and also sharing the link with your friends and anybody that you know who's interested in plastic surgery. Also send us some flowers and gifts. We always are happy to accept those and receive those. Getting back to your question, all things K. The mommy makeover will be tailored to you specifically. In general, it will include some type of procedure to address the belly area and usually the breast as well. So for her, we did a lot. We did the drainage tummy tuck, the fupa area, which you can see now is nice and flat, beautiful contours. We did lipo 360 to contour her love handles and hips and butt. We also did a little bit of fat transfer. She didn't want much, but she definitely wanted some. So she's got a little bit more of a contour to her buttocks and hips. And then we also did breast surgery for her with a augmentation and with some fat transfer. So everybody's different. It depends on what you're interested in having done. But at a minimum, it will be 2 to 3 procedures that we combine for your mommy makeover. Leanne Rose says, I've had some work done in Mexico, but I don't want to go back for the rest of the work. I need, for the rest of the work you need done. Well, you're welcome to come and see us. We will be happy to take care of you. Put in your information in the bottom left of the screen there, and we will reach out to you and guide you through the process. Jeannie left a message for Linda too. Is it possible to get a revision to the arm lift at the same time as a body lift? It is. Yes, I've done that on several patients who've come in before they've had surgery, several years ago with other surgeons, and they've come in for revisions. And on top of that, I did their body lift, so with fat transfer and things like that. So there's definitely different types of procedures that we can add, but it all depends on what you present with, what we're going to do. The way I stage these procedures, thank you very much for joining us. Ask your questions. Don't be shy. Thank you guys on YouTube also for joining. Type in your questions. So for the, what was I talking about? I think I was talking about the mommy makeovers and bringing in arm lifts and things like that. So the way I stage these procedures is we try to do the surgeries within a 6-hour window at a time. Tomo, hey, hi doc. How do you prepare the day before for a long surgery of 7? Me, personally, I make sure I get some good sleep. So tomorrow I actually have one of those big surgeries. I have a combination of a breast lift, which typically would be anywhere between 2 to 3 hours long. The breast can be very complicated and difficult to try to get them nice and even. So it does take some time. And I'm combining that with a body lift, which is the combination of the tummy tuck, the drainage tummy tuck, the monsplasty to lift up the fupa area, the hip lift and butt lift. So that's going to be about 6 to 7 hours. So I'm going to make sure I get some good sleep tonight so that I'm fresh and ready for my procedure tomorrow. Angela Longnumber, do you do calf lipo? I don't typically do calf lipo. I haven't had any patients who've required it. But we can always examine you and see if there's any indication for calf liposuction. We'll be happy to get you in for your consultation and see what we can do for you. Debbie Castaneda, I'm looking to get a mommy makeover with lipo 360 very soon. Wonderful. We'll be happy to take care of you. Definitely come in. If you know that you're going to be having surgery within the next 3 to 6 months, by all means, contact us now. Come in for your consultation so that we can make sure that we do the workup to make sure you're safe and healthy so we can proceed. And also book the time for your surgery because we do share the surgery center with other plastic surgeons. And so we definitely want you to make sure, we definitely want to make sure that you get, the dates that you're interested in having. But yeah, we'll be happy to take care of you. So tomorrow, I know you guys also ask about age. That's one of the questions that comes quite often. I'm 50 years old or I'm so-and-so years old. Am I too old to get plastic surgery in these body contouring procedures? The answer is that age is not a limiting factor. It is your overall health that I look at. to determine whether or not it's safe for us to proceed with surgery. Tomorrow, for example, I'm operating on a 60-year-old patient. I've operated on patients in their mid-60s, late 60s, even in their early 70s and mid-70s. So, and they have done extremely well. So age is not really the limiting factor. We look at your overall health. So looking forward to it. For pricing, so Sahan is asking how much is the Lipo 360 plus the drainless tummy tuck. Please go ahead and contact us or put in your information in the bottom left of the screen. There should be a form there. We will reach out to you and give you some estimates. I know for mommy makeovers, they can range anywhere between $15,000 to $30,000, depending on all the procedures that you put in. So if you want like an extensive mommy makeover, arm lift, liposuction, Lipo 360, fat transfer, breast work, as well as the drainless tummy tuck and some Renuvion J plasma. Those are a lot of procedures done, and that could, range, like I said, put you in around $20,000, $25,000, even $30,000 for your full mommy makeover. Everybody's mommy makeover is going to be different, and their quote is going to be based on the procedures that we do specifically for you. So, Tomo, I got happy news. I will be calling you soon. Wonderful. Looking forward to it. Thank you for following us. I know you've been following us for quite some time, and definitely looking forward to taking care of you. Angela Correa, what about the belly button revisions? Yes, so I've done belly button revisions on patients before who've had surgeries elsewhere. It all depends on what your belly button looks like, what you present with, and I need to be able to examine you and see what the treatment will be, how I can fix it, how I can make it better. And everybody's different. Prada Rempersad, what about treating someone with PAD and diabetes? PAD, what is that acronym? Let me look it up very quickly. Peripheral artery disease. Okay, so it all depends on what is causing that peripheral artery disease. We have to make sure that your symptoms are not active and that you're actually medically stable for us to be able to move forward. As far as like the diabetes, if you got diabetes and your hemoglobin A1C is 7 or less, we can move forward with surgery. I've had patients who come in, they've got type 2 diabetes and their hemoglobin A1C is 10, sometimes 12. That's too high. We have to get that under control, bring it down to 7 or less before we move forward with surgery. So for you specifically, we'd have to do more in-depth workup and then make sure that your medical conditions are stable enough, and then we can move forward with surgery. Resh, how many treatments need to be looked slim without mommy up? I'm not sure exactly what I understand. If I understand your question, can you reword it? And I'll try to answer that. Okay. Have Apple long number, Apple user long number. How about HSV? So if you have HSV, we can definitely operate. We'll probably have to put you on some prophylactic medications so that you don't break out. Yeah, and I've operated on patients with HSV, so that shouldn't be an issue. Tomo, as long as you're not having any active breakout, we can't operate on you if you've got active breakout and infection during that time. We'll just have to wait until your body controls it, and then you're safe to go, and then we can go. But we'll still give you some prophylactic antiviral medication. Let's see here. Tomo, what is your take on endoscopy deep plane facelift? I'm not sure what all is involved in endoscopy deep plane facelift, but the way I do my facelifts definitely is with the deep plane procedures. Endoscopy, I'll use it, for example, for the brow lift. But there are also techniques that we can do where we don't need to use an endoscope. An endoscope is just like inserting a camera so we can actually visualize where we're operating. I don't think it's really necessarily needed for a facelift. You can see everything quite well without the need, without needing to use an endoscope. But if somebody uses that procedure or that technique, definitely look at their before and afters. And if you like their work, definitely you can go with that. Like I said, plastic surgery is fun because there are many, many different ways to approach a problem. And as long as you're getting consistent, good results and patients are happy with them and are doing well, there's no necessarily right or wrong answer there. Sky, I've gone from 447 to 234 pounds. Fantastic. Congratulations on your weight loss. But now I have an apron that hangs mid-thigh. Okay. Do you accept insurance? No, we do not accept insurance. All of our patients will pay out of pocket. But you can see if your insurance will accept to pay for somebody who's out of network, and perhaps they will reimburse you directly. So the patients that I operate on, even when they get insurance to cover their surgeries, they will just negotiate with their insurance to try to get paid directly. We don't take insurance. Resh, does treatment is freezing fat or it's kind of surgery? Okay, so you're asking. Thank you very much for that hot pepper there, Jean-Marie. I appreciate that. So freezing fat or it's kind of surgery. So for me, I don't use the. I think you're referring to. Cool sculpting. So cool sculpting is what you do to freeze the fat and try to get that fat down. When I do these procedures, I don't use that treatment. That's a non-surgical treatment that really is specific to just a few patients that will qualify for that. The majority of patients don't qualify for that. And if you go to like a spa that offers that, they'll try to sell you on it, but it's not necessarily going to give you the results that you want. Liposuction is what I do. So actual surgery with you being asleep, and I remove that fat mechanically and actually get all of that fat out to give you a nice contour. So that's different. Let them 82. Would you do a fleur-de-lis tummy tuck and a chest lift at the same time? Yes, that can be done. Yeah, we can do that. We can combine those two procedures at once, not a problem. So put in your information in the bottom left of the screen there. We will reach out to you and walk you through the process. China, what is a drainless tummy tuck and is it expensive? So the drainless tummy tuck is the technique that I use. Traditionally, when you have a tummy tuck, the surgeon will place drains. And you'll have those drains usually for about 2 to 3 weeks before they come out. If they come out too soon, you're at risk of forming seromas, which are fluid collections that need to be drained. When I do the drainless tummy tuck, it's a technique that I use to actually close everything up so that you don't need to have drains, and it allows you to have a much faster and easier recovery. Is it expensive? No, it's not expensive. I think it's very, very affordable. The price for that for us right now is at $13,000, and that's mid-range. I have other plastic surgeons that charge a lot more for their tummy tucks, and they don't even do the drainless technique. So it's all relative depending on where you are, if you're in the US or if you're in different countries, or if you're also in different regions of the US. But in our Houston markets, $13,000 is the price for the drainless tummy tuck here for my fee. And that includes anesthesia facility and surgeon's fee, as well as all your post-op garments, your post-op follow-ups, and the scar cream that we send to you. Liwa Babe 2. Can I get tummy tucked with fibroids? As long as you're not having any issues with your fibroids, yes. They shouldn't be an issue for you to get a drainless tummy tuck. So we'll be happy to take care of you. Miss Tina. Oh, what happened? I think your question was pinned and then removed. So Tomo, all right. Do you recommend using a use of faja before surgery to get used to the compression? No, because when I do the tummy tuck or liposuction and all that, your body's going to change. So using a faja right now doesn't really make sense because you're going to be losing a lot of fat. So for example, if this patient here were wearing a faja, it makes no sense. She's got like probably, she probably went for, I don't know, like a size 8 or size 10, and she probably dropped at least 2, 3, or 4 sizes. So it really doesn't make sense for you to get a faja before surgery. Get the faja, you'll get the faja after, and then compress your body appropriately. Okay, so China is asking, how can I get more information? There should be a form on the bottom left of the screen here on your TikTok screen. Click on it, put your information in it, and then we will reach out to you and answer all your questions. You can also call my office, 281-724-3138. during business hours or text that number, and we will reach out to you. Vicky Aisu, hello, welcome back. Is it mandatory to do constant exercise and dieting before you maintain your outcome after a tummy tuck? It is definitely highly recommended that you get into a healthy lifestyle, dieting, exercising, so eating healthy. I don't necessarily tell people to diet in a sense to follow a specific diet. I just want you to be able to eat healthy, reduce your portions, increase your activity, and get into that lifestyle where you're actually able to maintain a steady, healthy weight. That's most important. Olure Miyomole, what age limit can you do a tummy tuck? Okay, so I answered that question earlier. Like I said, it's quite a common question. There is no age limit. I've operated on patients in their 50s, 60s, 70s, and they've done very well. What I look at is your overall health. So if you're healthy enough to undergo these procedures, then we can move forward. Miss Tina's actually tomorrow, I'm operating on a 60-year-old. I'm going to be doing a combination of a breast lift and the circumferential tummy tuck or the body lift. Miss Tina, I would like to get a facelift. What will be the range of price for a facelift? So facelift definitely will vary in pricing. So we definitely need to know what exactly is going to have to be done. So contact us, put in your information there, and we'll get a little bit more information from you, and then we'll be able to kind of give you some estimates. But it can range anywhere between probably $18,000 to, I mean, some surgeons will do facelifts at $50,000. So it's a big risk. I mean, there's some other plastic surgeons who do facelifts for $100,000. It all depends on what needs to be done, how many procedures we need to do on the face. If it's going to be a full facelift, quad lift, so upper eyelid, lower eyelid, fat transfer, brow lift. You know, there's a lot of stuff that we can do to rejuvenate the face. It all depends on what needs to be done. Laura, hello, Dr. D. I have a question. How long do we wear the compression garment after surgery? So for tummy tucks, you're going to wear that compression garment or the binder for at least 3 to 4 weeks. So usually a month. After that point, you typically don't have that much swelling. You're going to continue to improve with your results. Of course, if we've actually combined liposuction, you're going to wear those compression garments for about 2 to 3 months. It's a longer process. We definitely want to keep that compression. San, do you accept care credit payment? Yes, we do. We take 4 options: care credit, Alpheon, patient fi, and cherry financing. So please go ahead and contact us, and we'll be happy to guide you through the process and take care of that. Sorry, what? Can you guys hear us? Can you guys hear me now? We might be having some issues with the microphone. So let me take out the microphone. I think, sorry, I didn't know you guys weren't able to hear me. All right, so Laura was saying, Dr. D, I have a question for how long do we have to wear the compression garment after surgery? So for the tummy tuck, you're gonna wear that for about a month, anywhere between 4 to 6 weeks. If we combine the tummy tuck with liposuction, it's going to increase the time for you to actually wear that compression garment because you're going to be decreasing in sizes over the course of about 3 to 6 months. But you are probably going to wear those compression garments for at least 3 months. So for example, if we start with an extra large garment on you, right? So we do the mommy makeover. We remove all of this fat, the skin, get you a nice tight belly. We do the liposuction, contour, everything. Then you're going to have your compression garment, and you're going to go down probably every 2 to 3 weeks. Extra large, go to a large. From a large, you're probably going to go to a medium. And by the time you get to 3 months, then you can stop using the compression garment. Sahan, do you accept care credit payments? So again, we accept 4 types of payment options: care credits, patient fi, cherry financing, and Alpheon credit. So contact us, and we'll be happy to get you in for your consultation and get you on the books for your surgery. Cindy Ochoa, what is your arm surgery like? I hate bat wings. So for patients who have bat wings, the scar will go typically from the elbow all the way into the armpit. But we have to make sure we look at you specifically to know where that excess is. Some patients may have some excess that goes all the way into the forearm, at which point I will extend it and go into the forearm to remove that excess. Some patients will have a lot of excess in the bottom part of their armpit, so we'll extend the incision to go down and remove some of that excess. So it all depends on what you present with. Shay Bell, how long does swelling usually last after a third-lead tummy tuck? So I do the drainless technique whenever I do these body contouring procedures, so you won't have any drains in it, and the swelling is minimal for my patients. Usually they'll have a small amount of swelling probably for the first 2 weeks. After that, it's virtually absent, but it's a small amount. If you have the traditional way where you have drains in it, you may have swelling for a much longer period of time, probably anywhere between 4 weeks or so or more. Wonderful. Okay, good. I think we've answered the majority of the questions. If we've missed your questions, please go ahead and re-ask them, and hopefully we'll be able to see them. Thank you very much, Danny Sachs. I appreciate it. Laura, after 6 weeks, do I transfer to a faja or is it up to me? I only had a drainage tummy tuck. So if you've had a drainage tummy tuck, no. After 6 weeks, you should be fine. If you want to wear a faja, some patients will because they feel comfortable wearing it. You can. It's not going to hurt anything, and I'm not against it. But I don't require you to wear it. Patricia H. Hi, do you do treatments for scars? Yes, I do. It all depends on what your scar looks like. Sometimes we can do a scar revision so I can excise it and remove it. So some patients, for example, have had quite widening, a lot of widening of the scars. Actually, I just did this earlier this week. A patient came in. She had the arm lift surgery, right? The arm lift surgery tends to have some pretty wide scars. That's kind of typically how it heals. But hers were very wide. And we'll post these videos on TikTok at some point. But her scars were about 4 centimeters wide, which is about 1.5 inches wide. It was pretty wide. So I did this under local anesthesia. She was completely awake. In some patients, we can do these procedures with patients awake. I did that on both arms and fixed her scars. Very nicely thin, and we have to make sure she heals well. But it's going to definitely make a difference there. Anna Sweet Bear, does plastic surgery go along with menstrual cycles? Will it change? I'm not sure what you mean by that. I don't think plastic surgery is related to the menstrual cycles, but maybe you need to elaborate a little bit more so I can understand what exactly you're asking. Boss lady, hey, thank you. Thank you for your roses there. I appreciate that. Reword your question, please, so I can understand. I didn't quite understand what you were asking. We've got some interesting comments here. Okay, Danny Sachs is saying, this doc is top tier, one of my faves in Houston. Thank you very much. Can't go wrong with Dr. D. I appreciate it. Sherry is saying, do not finance this. It's ridiculous. We are beautiful. Absolutely. All our patients are beautiful. It is their choice to decide whether or not they want to have surgery. And we have to respect that as well. Carla McCauley, how soon can you travel after surgery? So the majority of patients who come in to see me who are from out of town or out of country, you'll stay usually for about a week. Some patients will stay longer. They have family or friends and they want to stay a little bit longer in Houston, but usually you'll stay for a period of about a week. That's when I see you after surgery, and then you can head back. Anna Sweet Bear, tummy tuck and fupa repair, do those change the cycle? No, they don't change your cycle. So the plastic surgery does not affect your menstrual cycle. Okay, thanks for rewording your question. They don't affect your menstrual cycle. What they do is they work on your skin and fat area, so they contour this area. So for example, here I did the tummy tuck and the monsplasty, so I repaired her fupa. So she has a very nice flat belly that goes all the way down into her mons pubis area. So for example, before, when she looked down, she couldn't see her pubic area. Now she can definitely see it. which is really nice. And it also helps to keep things clean, so she doesn't have any issues with hygiene and odors and things like that. So it definitely helps. But it does not affect your menstrual cycle at all. That has to do with your hormones and your reproductive organs, which are inside the belly area there. And we don't go anywhere near that. All right. For pricing, everybody, please go ahead and contact our office. This is our phone number, 281-724-3138. For minor makeovers, pricing can vary anywhere between $15,000 to $30,000, depending on all the procedures that you put in. So there are a variety of procedures that can be done. And that includes facility fee, anesthesia fee, and surgeon's fee. Hello from Ghana. All right. God's favor. Thank you for joining us. Vicky Aisu. I like this before and after. It looks very nice. Well done, doctor. I hope mine will be like this. Thank you very much. I'm glad you like it. She is thrilled. She's very, very, very happy. Thank you for sharing your comment there. She be Netta. Will insurance approve cases where the pooch is extremely heavy, causing back pain? You can. I don't take insurance, so we don't take insurance. Anybody who comes to have surgery with us, even if they have insurance, will pay out of pocket. Now, insurance may pay you directly and reimburse you a portion of the cost of the surgery. But if you have those types of symptoms, I would say contact your insurance and go through your benefits. Go through also a primary care doctor who can document the back pain. You pretty much want to document everything that is making it difficult for you to live. You have to also document that you've been working on weight loss and that excess pannus and skin is really bothering you. If you have sores, there's a lot of stuff that you need to document to get medical necessity for the insurance to cover that. And it all depends on what type of insurance you have. But we don't take insurance. We do the surgery and you pay out of pocket. Anna Sweetbear, are there cases you turn down no matter how much money offered? Yes, there are some that are not appropriate patients or safe to move forward with, and I won't operate on them. If the patient is extremely rude and is disrespectful, we don't have to operate on you. This is also a when you come in and you, of course, here already on TikTok, you already see kind of like, what my mannerisms are. You see my before and after. So you kind of already get a feel for, do you like me? Do you like the way I answer questions? Am I providing value? Am I giving you information? When you come in, you get to see us as well. You see our office. It's kind of like an interview, I guess you can say. Do we fit? And you want to do that with all your surgeons, whoever you're choosing to go with. You want to make sure that you feel comfortable, you feel like you are appreciated, that people are actually taking care of you, and that they will care for you after the surgery as well. The flip side is also we get to see what kind of patient you are. And very rarely when we have some very difficult patients that are disrespectful or very unreasonable, we won't operate on them. There's no need for us to go through that pain. Val, what type of anesthesia is given? I do, my anesthesiologists do total intravenous anesthesia. So you're going to be completely asleep for the majority of these procedures. There are some procedures that we do under local. So you're awake and we can do surgery with you awake in the office. It all depends on the patient. Some patients are too anxious to be able to sit still to have surgery with them awake. Other patients are very comfortable. The types of procedures that we can do with you awake in the office are upper eyelid surgery, where if you feel like you've got a lot of excess skin and it just makes you look tired, we can do the upper eyelid surgery. It's fairly quick. Usually it's around 20 minutes or so, 20 to 30 minutes in the office. The longest time is just to numb you up. And then we take care of that for you. We also do a series of other procedures. We can do scar revisions we talked about. We can do the mini tummy tuck. A subset of patients will qualify for that type of procedure. We can do labiaplasty. We can do lipoma removal. Lipoma is a collection of fat that people will have underneath their skin in different areas of the body. We can remove those as well. We can remove implants. So if you had breast implants and you want to get those removed, we can do that. There are small revisions that we can do under local anesthesia. So I did a arm lift surgery revision for my patient earlier this week in the office under local. She was awake. So there are different things that we can do. But for these big mommy makeover procedures, you're typically asleep. All right. Let me answer some of the questions that I've written down. Thank you. Hey, how you doing, Dr. Chap? Nice to see you. Hope all is well. Okay, so people ask about the BMI, right? Okay, so I answer the BMI question. Let me answer Val's question. Do you take nervous patients? Yes, we've had plenty of patients who've had anxiety, who are scared of having surgery, and we are able to actually get them comfortable enough to come in to get their surgeries done, and even so come twice because we have to stage procedures. And so for patients who've had massive weight loss and have a lot of sagging skin all over their body, we can't do all of the procedures at once. So we will stage them. And I've had a patient who's very afraid, very anxious by nature. It's not just surgery, it's just in general. She's done extremely well. So we'll be happy to take care of you as well. Resh, so you hold the skin and then put some kind of laser pipe, and after the surgery, does the fluid come out? Okay, so I think you're talking about liposuction. For liposuction, yes, we make a small incision. It's a very tiny cut. We make plenty of tiny cuts, very small cuts, and then we insert a cannula. We insert the cannula, and then with suction, we're able to actually suck that fat out to really contour the body. But for tummy tuck, it's not that. We actually cut it out. So the scar is right here below. So the scar is hidden. It's hidden very well in the bikini line. But then it does leave a scar. So that's actually cutting things out. So for example, on a tummy tuck, from here all the way to here, I remove all of this by cutting it out. And I pull this point, bring it down here. That's what she has. So this point down here used to be up here by her belly button. So all of that pannus is gone. That's how the surgery is done. Okay, so Tom was asking, do you have another office beside Houston? No, I'm solely based in Houston. But thank you for the question. Yeah. Garcia Moore 0724. Looking for information about tummy tuck. Had liposuction in August last year. My tummy is, I'm trying to get to the rest of it, is very flabby. That can happen. So if you get only liposuction when you need both, it can leave you with some flabby skin. So August of last year, you're coming up on 7 to 8 months now. We'll give it a good 3 more months before we can move forward with surgery, but you can definitely come in now so we can take a look at it and see what needs to be done. So during this tummy tuck, if you've got that flabby skin and it hasn't retracted, you may benefit from that. So put in your information in the bottom left of the screen there. There should be a form. It's the easiest way for us to reach out to you. That way you give us your phone number, your name, email, and then my patient coordinator, Linda, will reach out to you and answer your questions. Get you in for a virtual consultation if you're out of town or out of state or even out of country. But if you're in the Houston area, by all means, come in person. We'll be happy to take care of you in person as well. And this is our phone number. So if you want to call us during business hours, Monday through Friday, definitely do that. Vicky Aisu, I hope I will get discounts from you when I come, since you are so kind and patient. Thank you very much. We give every patient a fair price. So we'll be happy to take care of you as well. And I'm looking forward to taking care of you. Continue on your weight loss journey there, and definitely reach that goal so we can move forward with surgery. You're going to be very happy with the process. Please take a look. For those of you who don't follow us, please go ahead and follow Deigni Plastic Surgery. And you can also follow us on YouTube. We're starting to upload some content there as well. We just did 2 interviews from some of our patients, and they've been very kind to share their experience. So definitely go and listen to them as well. We'll try to post them on TikTok as well. We already posted, I think, 1 or 2. We may have already posted them on TikTok. I forget, but definitely go through our content and you'll see all that information. Val, how far out are surgery dates? It all depends on what surgeries you want to have, but typically the quote is good for 6 months. So if you're coming in and you're healthy enough to go forward, usually the turnaround time will be anywhere between 2 to 4 weeks, depending on how healthy you are and if we can move forward with the surgery. Yeah. Mama Bears, just popping in to say hi. Looking forward to my surgery this July. Excellent. Thank you very much for stopping by. I appreciate the shout out and looking forward to taking care of you. Gwenbo Stone, 360 lift. Yes, I do those. The body lift is what I call it. So the scar goes from the butt area all the way around the hips and then into the belly area to treat the whole belt line. It's a beautiful transformation. I'm actually going to be doing that tomorrow on my patient who's 60 years old. And I'm going to combine that 360 lift or body lift with breast lift as well. So it's going to be a wonderful mommy makeover for her. It's called Hyla. How long? How long do I have to wait with mommy makeover after hysterectomy? Okay, so after hysterectomy, we want you to heal for about 9 months before we can do the mommy makeover. That will give some time for your scar to your incision and your cut to heal so that we can go back in and then do the procedures. So just contact us. Like I said, our quotes are good for 6 months. So if it's already been, say, 6 months since your surgery, you can come in and see us now. That way we can plan ahead of time and book the dates for you so you can get your surgery done. Mickey Penny. Can I use my insurance to get a paniculectomy? You should be able to. I think the majority of insurance companies will cover a paniculectomy. Some don't. So you have to check on your benefits. If you come to me, I don't take insurance, so you'll pay out of pocket, but you could probably have your insurance reimburse you part of that cost. So I've done that with some other patients before. I do the drainage technique, so it helps to make your recovery a lot smoother and a lot easier. But continue to do your research. Definitely contact your insurance company and ask them for in-network plastic surgeons who will take your insurance. That way, at least you'll be guaranteed, as long as your insurance covers it. If your insurance doesn't cover it and you have to pay out of pocket, you can come and see us, and we'll take care of you as well. Great questions. All right, so I was saying, the BMIs. So a lot of people will ask, if we do a surgery on all BMIs, the max BMI is 35. What does that mean? So if it has to do with your height and weight, and these are general guidelines. Of course, when I see you in person, I can decide whether or not we can move forward and if it's safe enough to be able to do certain procedures. So if you're 5 foot tall, the max weight will be 179 pounds. And please go ahead and share the link with your friends. Don't forget to do that. We appreciate that so they can get some information as well. If you're 5'2", it's 191 pounds. If it is your height is 5'4", your max weight will be 204 pounds. If you're 5'6", 216. If you're 5'8", 228. And if you're 5'10", 240 pounds. The higher your BMI, so if you have a BMI of 38, 40, 42, 45, the higher your risk of wound healing problems and surgical complications gets. So we want to bring your weight down because we can control your weight to a safe zone so that you can undergo these procedures without any issues. So Melissa and Raul Rodri is saying she's 4'11". So for 4'11", you're probably going to be around 172 pounds. Is what you would want to be. That will be your max weight. So if you're anywhere, around 150 pounds and you're 4'11", you're fine. We can definitely do your surgery. Okay. Great question by Tomo. Do you use J plasma for hand rejuvenation too much hand washing in a hospital setting? So I don't use J plasma for the hand. For the hand, typically what I'll do is fat transfer, but it all depends on what you present with. But most patients will have like some wrinkly skin and some really loose skin. So what I do is rejuvenate it by putting some fat in it. It works very, very well. For the BMI as well, everybody, I have some videos on TikTok where I actually explain and have you go through easily what to do to find your BMI. So you can actually go to Google and just type in BMI calculator, put your height and weight, and then you'll get your BMI. But just to reiterate, 5'2", max weight 191. If you're 5'1", max weight is 185. Thank you very much. Yes, Laura. Dr. D is the best. I'm really happy with my results. I'm very, very happy for you too. You are a high BMI patient. So thankfully, she was able to heal well without any complications, which is great, or wound healing problems. We're very happy. But there is definitely a higher risk for patients who have higher BMI. Bella, I just answered that question. What BMI should you be under? 35. But thank you for the question. Like I said, it's quite common. And I know there's a lot of people just coming in right now and you're popping in for like, a couple minutes and moving out. But you're very welcome. And thank you for your question. I appreciate it. 5'3", KK is 5'3", 169 pounds. Can I do just liposuction? Yes, we can do liposuction. Now, it all depends on what your skin quality is like. But at 5'3", 169, we'll have to examine you, and we can most likely just do the liposuction. Yeah. So come in and see us. We'll be happy to take care of you. I think I'm going to keep answering a few other questions. We definitely touched up on medical conditions with the type 2 diabetes and peripheral artery disease and other conditions. We talked to, Rock05, I am diabetic. Do you think a tummy tuck is viable for me? Talking about diabetes, type 2 diabetes, we want your hemoglobin A1C to be 7 or less. If it's less than 7, you're good to go. I've operated on patients who have diabetes, who have had their hemoglobin at 7 or less, and they've done very well. If your hemoglobin A1C is too high, we have to bring it down, then we can move forward with surgery. And we'll be happy to take care of you. I've done BBLs, liposuction, breast surgery, tummy tucks on patients who have type 2 diabetes, but we make sure that their blood sugar is under control. Stacy, 56. Do you know how long we have to wait to work out after a BBL? So typically, we'll have you wait about 4 to 6 weeks. The reason being is that fat that we transferred takes time for it to establish its new blood supply. So we want to make sure that we don't irritate it and destroy the fragile fat cells before they've actually had a chance to establish the blood supply and be happy in their new space. Kim Possible, how much is your consultation? So to book your appointment is $150. And that also goes towards your surgery when you book your surgery with us. What about patients with high blood pressure? Yes, so you'll get a B. So medical conditions in general, we need to make sure that your medical conditions are controlled. So that goes for high blood pressure, as long as you're under control. So you're taking some blood pressure medications. We'll get cardiology to get us a medical clearance. So you will need at least a 12-lead EKG at a minimum. You may need a stress test, a stress EKG to get your clearance. Regardless, once you're cleared, we can go ahead and move forward with surgery. Luna Star, tummy tuck and BBL and Lipo 360. Yes, we can definitely do those. You're very welcome, Kim. Much appreciated for your questions and for participating. We can combine the BBL, Lipo 360, and the tummy tuck in one procedure. Yes. Mo, butterfly. What about non-invasive lipo? Non-invasive lipo. You'll have to explain that to me because liposuction is invasive. I'm not sure there is non-invasive lipo. You may have like non-invasive fat reduction, so kind of like cool sculpting type. But liposuction is an invasive procedure by definition. Izzy Fly Gal. So there is not like a base rate for procedures. No, there are estimates. So for example, the drainless tummy tuck is around $13,000, but everybody needs something different. So budget wise, for plastic surgery, you can budget, say for example, anywhere between $15,000 to $30,000 to probably even more than that. It all depends on what type of procedure you're having, how many of those you're combining. So everybody's different. So a mommy makeover for one patient will be different than a mommy makeover for another because they have different procedures that they combine. So their quotes are going to be different. And also people present with different types of previous surgeries and problems and things like that that can increase the time of surgery, which also affects the pricing. What's PAPI 2323? After a mommy makeover, how long will it take to go back to work? So typically you'll be able to go back to work within those 2 to 3 weeks, depending on what type of work you do. If it's desk job, usually by the second week, you're back at work. If it's something that requires a little bit more like walking around properties and things like that, if you're a realtor, driving and things like that, with a little bit more activity, probably around that third week, you'll be able to go back to work for a full mommy makeover. Yeah. But for example, for the drainless tummy tuck, most of my patients are back to work within a week. Nicole, who is a good candidate for reverse tummy tuck? Good question. So the reverse tummy tuck deals with the excess skin and fat that is on the top part of the belly area near the breasts. And so the scars go up and then underneath the breast. So it all depends on what you have there. Those are the candidates for a reverse tummy tuck. We don't do those quite often because the majority of our patients we can treat by doing the regular tummy tuck, well, the drainless technique, but pulling things down instead of going up. Mo Butterfly, like air sculpt or a procedure that doesn't require to be put to sleep. So a procedure that doesn't require to be put to sleep, is still invasive. So I understand what you're saying. So you're talking about like awake versus under or being asleep. It's still invasive. Liposuction is still invasive. You still have to cut and go through the skin, get into the fat to remove that. But yes, there are procedures that you can do with you awake. You can do some awake liposuction. I've done that on patients. I don't do the full lipo 360 because I can't be as aggressive. If you don't want aggressive liposuction, we can do it under local anesthesia. You're awake. That can definitely be done. But for fat transfer and things like that, so if I need to get some fat for the face, if I need to get fat for the hands, those are small amounts of fat that I can typically get around the thighs or even the belly area, and we can do that with you awake. So there are types of procedures that we can do with you awake. Sweetheart, I don't know if you already said this, but do you remove excess skin? Yes, I do. So I do that with patients who have had massive weight loss, or even, for example, a tummy tuck, a mommy makeover. This is excess skin that she has with an overhang that she doesn't like. And then the fupa area is overhanging as well. So we definitely fix that, and I cut it out. LO 2384. I'm sorry if you already explained what is a mommy makeover. So a mommy makeover is a combination of different procedures. Typically, it will include a tummy tuck, and I do the drainless tummy tuck. And it will include at least 2 or 3 procedures. So it could be lipo 360, maybe some fat transfer to the butt hip area, or it will be some type of breast. Usually it's breast and belly area. That's what a mommy makeover typically is. So if you think about it, women who've been pregnant, they've had engorgement of the breasts, they give birth, they're done having their family, they've got their bellies who have gone up and then down, and they have some flabbiness in the belly, and then they have droopiness of the breast. Typically, those are the 2 areas that most women will want to have fixed. But overall, the mommy makeover has changed to where you can include other procedures in your mommy makeover package, and that's going to be your mommy makeover. Easy fly gown. How many weeks do you have to stay in Houston area after recovering? 1 week. For the majority of my patients, you'll stay 1 week. And Mansera 1975. Do you work with paniculectomy? 15830. I do, but I don't take insurance. So what I recommend for my patients who have insurance and their insurance will cover their tummy tuck, their paniculectomy, I make sure that you contact them to let them know that you're going to be going with an out-of-network physician, and if they can actually reimburse you directly. I will work on you and take care of you, but I don't take insurance, so you'll be paying me out of pocket, and then you'll work with your insurance to get reimbursed. Easy flag out. Where does the fluid go in a drainless tummy tuck? So the great part of that is your body reabsorbs it naturally. So because I actually put everything in place and stitch everything up with meticulous suturing, your body is actually able to start healing immediately. In the traditional way, this space is open and it moves and you have fluid that builds up. That's why you put the drains in. You put those drains in, and over time, about 2 to 3 weeks, the fluid goes down and then your tissues start to heal. I bypass that system and start having you heal from day 0 of surgery. So the day of surgery, everything's already touching and you start to heal. Mama Cow, I'm 4 weeks post-op recovery is hard. I'm sorry to hear that. I'm not sure who was your surgeon. I'm not sure what procedures you had, but hang in there and definitely follow your surgeon's instructions, post-care instructions. My patients tend to, for the most part, recover extremely well. I just had one of my patients that I operated on last week. She had a mommy makeover, lipo 360, and drainless tummy tuck. She's walking upright. I saw her just today in the office, doing great. She can drive, she can walk, and she's waiting to be cleared so that she can actually go to the gym and do some treadmill. And she's only 1 week out. So it all depends on the techniques and also on each patient. But for the majority of my patients, like I said, they recover very fast. Blair, I weigh 244 pounds. Can I get a mommy makeover? It depends on how tall you are. If you're 5'11", then yes, we can probably move forward with surgery. If you're shorter than 5'11", you have to lose weight because your BMI is higher than 35. And we need to get you in a safer zone so that you can go through this process safely and actually be able to enjoy your results. Rakobi, can you correct fibrosis? Very good question. It depends on how you present and what is there. We need to examine you and see what can be done. Who, what, huh? I think you've asked questions before. It's been a long time. What do you think of Renuvion versus the arm lift? Okay, good question. So Renuvion is the J-plasma, so the energy-based type of skin tightening procedure. It works in a subset of patients who have a little bit of skin excess and looseness that is not so overwhelming that they need surgery. So it's kind of like that in-between patient. Thank you very much for the rose there. I appreciate that. So it does work, but in a particular set of patients. Otherwise, if you have too much like bat wings, like one of the former comments was, you'll need a full arm lift. Renuvion is not going to help. Or it's going to help, but it's not going to give you the full results. LO Low 2384. What type of payment plans do you offer? So for payments, so financing options is Care Credit, Patient Fi, Alpheon, and Cherry Financing. We also have patients who pay cash, money order, or credit cards or debit cards. And the main thing is you have to have everything paid no later than 2 weeks before surgery. So everything has been collected, everything's paid, and then we can move forward with the surgery. But usually you'll schedule your time, you schedule your surgery, and then during that time you can make the payments. Tomo, have you had patient requests a drain to be placed on your drainless tummy tuck? No, I have not. It makes no sense to have a drain placed when you can have a technique that does not require drains. No patient wants drains at all. It's kind of like going back to getting around with a horse and buggy when you've got cars and planes and things like that. Nobody wants to or walking. I mean, you're not going to walk, to work if you're 50 miles away. You're going to drive and be comfortable. So no, definitely not. I would not put a drain in, even if somebody asked. There's no need for me to put a drain, and that would be bad care from my standpoint. African Houston hairstylist. I started working after 1 week of surgery. You did my surgery. Wonderful. Exactly. Well, thank you so much for your testimonial there. So, like I said, most patients, like for my techniques, are able to recover very, very quickly. Much smoother than the traditional one. So, of course, everybody heals differently, but for the most part, they do very well. Tina, Rulka, thank you very much for joining us. Looking forward to taking care of you soon. Soon Lily or Sunly. I have loose skin when I sit, but not as much when I stand. But need a muscle repair. Am I okay for a tummy tuck? I think you've asked a similar question. It all depends on what you look like when I examine you. So you need to come in so I can actually palpate your skin, see where the looseness is, and we can fix the separation of muscles. Especially if you say you can feel that you have the separation of muscles and get that fixed. Yeah. And again, it depends on your medical condition. If you're healthy enough, if you're good enough to be able to move forward with surgery, then we can go ahead and proceed. Put in your information, contact us, or we'll reach out to you, and we'll be happy to see you and take care of you. Liz JM, what do you think of awake lipo? Great question. So there are some patients where we can do awake lipo. I feel like awake lipo can be done in limited areas. If you want to do aggressive lipo 360 and a full BBL, it may be a little bit difficult because we need to make sure that you're comfortable to be able to undergo these procedures. Now, I've done awake lipo on patients where I'll do liposuction of their belly area. I can harvest fat, and I can transfer that fat to other areas. Say the back of the hand, I can transfer the fat to the face. I can also transfer the fat to the labia. I've done that before on patients who are awake, and I get the fat from the belly area or the inner thighs. That can be done with you awake. I dream of PIP. What is included with a consultation? With the consultation, so you'll get to, you'll see my patient coordinator, but then you also have a full consultation with me. So we talk about your treatment plan. We make sure, I examine you. If you're out of town, out of state, you'll send pictures so I can actually see the areas you want to get operated on, and I can develop a treatment plan so that we can, when we discuss things, we have a very productive conversation, and we can make sure that you get the appropriate treatment plan, and then we'll give you a quote. So that's what's included in your consultation. Prince Hadi. I'm 3 months post-op and my scar still hasn't healed. I would recommend that you continue to follow up with your plastic surgeon or the surgeon that operated on you. They need to make sure they examine you and see what's going on. Maybe there's an infection, maybe there's some fluid collections that's bothering you or not allowing your scar to heal. So definitely follow up with your surgeon and have them take a look at it and take care of you. Chocolate Barbie. I'm 2 weeks post-op and I had lipo 360 and my back still looks big with love handles. Will it go away? 2 weeks is still pretty early. Definitely follow up with your surgeon to make sure that there's not anything missing. As far as, sorry, I need to let TikTok know that we are still live. Okay, good. So definitely follow up with your surgeon. Make sure that they examine you appropriately to make sure there's nothing that they're missing. If there's a seroma that needs to be drained. Otherwise, if it's fluid, if it's not a fluid collection and it's just swelling, with lymphatic drainage treatments, with compression, appropriate compression, it will go down. Bree RN, can C-section adhesions be fixed? Yes. I've operated on patients who have had multiple C-sections. On right here, for example, below that overhanging part, most patients will have a C-section scar, and we can fix that. Absolutely. So contact us. We'll be happy to have you come in so I can examine you. We can probably do that under local anesthesia, so you'll be awake, and I can fix that area for you in the office. That will prevent you from having to pay, anesthesia fees and facility fees and all that stuff. So if you can get it done awake and it's safe, we will be able to do that. Izzy Flycow, are you in League City or Houston just due to the drive? Texas is big. Yes, Texas is big. I am in the River Oaks area, so the Galleria within the 610 loop. I have patients that come in from League City, from Friendswood, Clear Lake. I've got patients coming from Galveston, people that come in from the Woodlands. And then, of course, that's just the Houston area. We got patients that come in from all over the U.S. People coming in from Louisiana, Oklahoma, New York, Florida, California, Midwest, everywhere. But yes, Texas is big. We got people also from Corpus Christi and El Paso and Lubbock. Where else? I mean, you guys are here. Shout out from where you are from Texas. But yes, I'm in the River Oaks area by 610, within the 610 loop. Fish out of water. Do you have financing? Yes, we do. We have 4 types of financing. Please contact us, and we'll definitely get you through the process. We offer care credits, patient fi, Alpheon, and cherry financing. Black Host Wall 3. Doc, can you just say how much it will be? It doesn't matter how your stomach is. Can you just say it? Well, for the drainless tummy tuck, average cost is $13,000, and that includes the facility fee, anesthesia fees, and surgeon's fee, as well as your post-op garments, your pre and post-op kits, your scar treatment, and all your post-op appointments. So now, I don't know what you present with. I don't know what treatments you'll need. So it may be that you need more than just one procedure, not just a drainless tummy tuck, at which point we will give you a quote specific for you, and you'll know how much you'll be able to do. Yes, easy flag out. $13,000, everything included is not much of that. I just had somebody who reached out to me and said they paid $20,000 for their tummy tuck somewhere, I don't know where, and they're not happy with the scar. They're not happy with how they've been left with, some areas that are pooching, and they want a revision. So I think $13,000 is very, very generous with the techniques that I do and the results that we're getting. So come in and get it done now before prices go up. They will be going up. So definitely come in, and you're getting good price and good value for what we do. Kathy B. Cat 2. Does it leave a scar? The mommy makeover? Yes. So you will have scars. So this patient has scars, but they're well hidden. So the scar goes from hip to hip, right here underneath the bikini line. So it's hidden by the underwear. If you get breast surgery, like a breast lift, breast augmentation, you will have scars on your breast as well. If you're only getting, say, for example, lipo 360, you'll have very, very tiny scars, smaller than the width of my small finger. Very tiny pokes, essentially pokes, so we can actually insert the cannula and then remove that fat. User long number. I have 2 C-sections, but I have a FUPA. Is that possible to do a mommy makeover? Yes, to do a makeover, sure. Yeah, absolutely. I've operated on patients who had multiple C-sections before. They had the horizontal scars, they've had the vertical scars from the emergency C-sections, and I've been able to remove all of that and give them a beautiful, beautiful flat belly. Tomo, what vitamins you place patients on? I saw it in my quote, but did not mention which vitamins. You'll have a vitamin kit that will be part of your pre-op kit. So I think you're out of town, so when you come in for your pre-op, we'll give you all of those. We definitely also provide you with arnica and things to kind of help with swelling and bruising. Susie, what is the recovery time for body fat transfer augmentation? So my patients, when I do lipo 360 and BBL, they will usually wean off their pain meds within 5 days. Usually by that first week after surgery, most of my patients are walking upright, off their pain medications, and driving themselves. And they'll typically be able to go back to work. They'll start their lymphatic drainage treatments within that first week after surgery, and continue to wear their compression garments for about 3 months. Sexy B, can I do the procedure if I have high blood pressure? Yes, you can, as long as your blood pressure is under control. We will have to get medical clearance from your cardiologist, but then as long as we get everything and it's good to go, you'll be able to have surgery. I've operated on patients who've had high blood pressure very regularly. A lot of my patients have high blood pressure. Some have anemia as well, so we got to make sure that your blood levels are back to normal before we proceed with surgery. Sashi, this process is a surgery. Yes, for the mommy makeover, it's surgery. It's a surgical procedure that includes typically the drainless tummy tuck, the FUPA area for the monsplasty, liposuction, fat transfer, and some type of breast surgery. It could be breast augmentation with implants or breast augmentation with fat transfer and a breast lift. Barbara Walden, those are my before and afters. Yes, you recognize yourself. That is true. I love the work Dr. Deigni did. Ready for bikini season. So happy. Yes, that is you indeed, Barbara. Thank you for participating, and you look fantastic. This is just 3 months out. You're going to get even better by 6 months and even 9 months. You're definitely bikini ready for this summer. And thank you for participating and sharing your testimonial there. I appreciate that. Gladys 42921. Can I get the operation if I have high cholesterol? Yes, you can. I've operated on patients who have high cholesterol, as long as you don't have any impact on your heart and your coronary arteries, and you pass your medical clearance, you're fine. Growth. I am 43. Is it okay to do a tummy tuck? Absolutely. Age is not an issue. As long as you're healthy enough to undergo these procedures, you can get a tummy tuck. So the age is not the limiting factor. Tomorrow, I'm operating on a patient who's 60 years old. I'm going to do a combination of a breast lift and a full body lift, which is a combination of the hip lift, butt lift, and the tummy tuck with the fupa area. You're very welcome. Thank you for your questions. I appreciate it. Oh, and remember, I do these live sessions, Q&A sessions every Tuesday and Thursday, time permitting, from 7 p.m. Central Standard Time. Usually I do them for about an hour. We've been going on for about an hour and 15 minutes now, so I'm going to be wrapping up very soon because I do have to get ready for surgery tomorrow, bright and early, and I'll be posting videos about that. You're very welcome, Tom. We'll have a good night, and thank you for participating. And Johnson 7, I'm swelling at 6 weeks, but my surgeon said no more compression. What can I do? I mean, like I said, I want you to follow your surgeon's guidelines, but if you feel like you need a second opinion, you can definitely go and seek out a second opinion and see what might be going on. But if you have swelling, then compression can definitely help. Again, it all depends on where you're swelling, what type of procedures you've had. So definitely follow your surgeon's guidelines. But if you're still swelling, definitely keep telling them, hey, look, I think I still have some swelling here. What can we do? Just definitely insist and let them know. Queen T vibing. What do you think about repositioning threads? I don't do threads. I feel like they don't last long at all, and it's just not really worth your investment. But some patients, are not able to undergo surgery, so it may give them some help and relief and improvement, which will be temporary. So that could be done. Susie Q. I have hypothyroidism, 2 C-sections, and my A1C is 6.2. Can I get a tummy tuck? As long as your hypothyroidism is under control, yes. And your weight is under a BMI of 35, absolutely. I've operated on patients who have everything that you just described, and they have done very well. So put in your information in the bottom left of the screen there. We'll be happy to reach out to you and get you in for your consultation and book you for your surgery. We'll be happy to take care of you. All right. Okay. I think we're going to wrap it up tonight. I do have to enjoy a little bit of food so I can sleep and get ready for my surgery tomorrow. Okay. Thank you very much, everybody, for participating. Please follow us on all our social media platforms. Most active on TikTok, but I do have the lives going up on Instagram and YouTube. The handle is the same, Deigni Plastic Surgery. You'll probably see different content on different platforms because they do offer different restrictive restrictions. TikTok is very restrictive, so I have a lot of educational videos there. I do have some before and afters. You can also go to my website, deigniplasticsurgery.com. Contact us, come in and see us. We're always happy to put a face to the names and the usernames, and thank you for participating. Have a good night and have a great weekend. God bless you. Bye-bye. Thank you very much, everyone. Take care. All right, YouTube. Have a good one.